Over the years, I know the roles that pharmacists can play. I've been in multiple roles of medication management therapy, patient advocacy, all those types of things that a pharmacist can do throughout their career. And as a CEO, I thought, well, what could I do to help make sure I advance the pharmacist care within our outpatient setting? So in that outpatient setting, one of the ways I wanted to do is it was for ambulatory care. I wanted to make sure that we had the pharmacist roles defined in the clinic setting. Not specifically in the pharmacy, but as a role, as a team member, a patient care team member in our clinics. So in that I said, okay, let's make sure that we have the pharmacist have a presence there, go into the patient's room with the patient, do the information, gather information and stuff that the pharmacist can do, as well as provide recommendations before the physician comes in and provides that care of their diagnosis and everything that they're going to do with regards to a plan. So we went into that development, got a team together. They were all excited about having pharmacists on the team. And when we ended up developing it, we now have throughout our whole clinics and 3 sites as pharmacists as part of permanent members of our patient care teams in the clinic setting, in working with the providers, whether it's independent practitioners or other providers, and also with nurses. So they become a permanent member of that team. And as CEO, I go around and talk to a lot of people, ask how are things going, monitor the clinic. Well, one time in one of the, for whatever reason, the pharmacist didn't go into the room for that patient, and it may have just been for an acute care service or something like that. So the patient comes to me and they actually said, I didn't see the pharmacist today in my room. And I thought, wow, and you started that, you implemented it. And then you actually get a feedback when a patient expects that kind of care and service. So now the expectation level is there, and that's really great for our patients because that means that they're going to get improved care services. Pharmacists deserve provider status because they are critical members of the healthcare team. In the team involvement of independent practitioners, nurses, other providers that may come in and provide services, the pharmacist plays a key role in the gap between what you can do with medication management and the diagnostician and then the outcome of those patient care services. In that role then, the pharmacist becomes a key element, and if you subtract that role, you impact so much on that patient's ability to understand their meds, being able to understand if there's other issues going on, and just another way to gather sources of information that's going to make that patient care plan that much greater. And in that aspect then we improve healthcare outcomes overall. The pharmacists are accessible, they're knowledgeable, and they have the kind of skills and experiences that can help provide an important component to any kind of healthcare team.